We are going to discuss about spleen. So what are the important points in relation to spleen you must have to know? Number one thing, as you can see in this diagram, that spleen, it is a wedge shaped organ. It is a wedge shaped organ and it is lying in your, as you can see in the diagram, in your left hypochondrial region and also in the epigastric region. So some part of the spleen is also in the epigastric region. It is wedged in between the, as you can see in this diagram. So this is your spleen. So it is wedged in between the fundus of stomach and the diaphragm. Okay, so this is the diaphragm, the left dome of the diaphragm. So it is wedged between the diaphragm and the fundus of the stomach. Okay, and please remember that spleen, it is one of the largest lymphoid organ. When anyone is going to ask you which is the largest lymphoid organ in the body, our answer is spleen. Okay, so please remember, spleen lies in relation to this 10th rib, as you can see in this diagram. Okay, so it lies obliquely along the axis of your 10th vertebra and it is making an angle known as 45-degree angle. So please remember, the spleen lies obliquely along the axis of the 10th rib. Okay, and it is going 45-degree angle and it is making an angle of 45-degree with the horizontal plane. So this is the horizontal plane and your spleen is making a 45-degree angle with the 10th rib. Okay, so what are some of the important features of the spleen which you must have to remember? So what are the external features? It has an anterior end, which is also known as lateral end. Okay, and then it is having a posterior end, or also known as the medial end. Okay, so you now see in this diagram, this is the anterior end or basal area of the spleen. This is the posterior end or medial end of the spleen. Please remember, posterior is more medially. Okay, so posterior end, it is also known as medial end and it is rounded, as you can see in this diagram. Okay, it is directed upward, backwards and medially. If you compare it with the anterior or the lateral end, it is an expanded end, as you can see in this diagram. It is an expanded end and it is directed downwards and forward and it will reaches up to your mid axillary line. So it can reach up to your mid axillary line. Okay, now it has some borders also. So what are the borders? See here, this is the superior border. Superior border is notched, so these are the notched. So superior border is the notched border. Okay, inferior border, this is the inferior border, and this one here, this is the intermediate border. Okay, so three borders of the spleen: superior border, which is notched one, so this is the superior border, posterior border and the intermediate border. See here, superior border, it is notched. Okay, this is the inferior border. Okay, inferior border, and it will be your intermediate border. So it will be your intermediate border. Okay, intermediate border. It is also having two surfaces. It is making here two surfaces, one in relation to the diaphragm, which is a smooth surface, as you can see in this diagram. It is known as the diaphragmatic surface. So diaphragmatic surface is smooth and convex. So it is smooth and convex. This is the visceral surface. Visceral surface is very important. Why it is important? Because here the hilum of the spleen is present. So the visceral surface is concave and irregular. Okay, it is concave and what? It is irregular. Now some important points in relation to spleen which you must have to remember is this value 1, 3, 5, 7, 9, 11. Okay, so please remember spleen is 1 inch thick. It is 3 inch or 3 inches broad. It is 5 inches long and it is 7 ounces in weight. Okay, so 3, 5, 7, remaining is 9, 11. So it is in relation to your 9, 10th and 11 ribs. Okay, 9, 10 and 11 ribs. Please remember spleen. See this diagram, all students. So this is the spleen. Okay, and it is in relation to your 9, 10th and 11 ribs. Please remember spleen does not extend below the costal margin. It is not going to extend below the costal margin. That's why spleen normally is not palpable. Okay, it is normally not palpable. Okay, please remember, unless if there is splenomegaly, if the patient comes to you with splenomegaly, then the spleen is palpable, otherwise it is not palpable. See here, this is the superior border, which is the notched one. See here, these are the notched. It can be present here also, but mainly it is present on the superior border. Okay, posterior end of the spleen, anterior end of the spleen, inferior border, and this is the superior border, and this is the intermediate border. This is the hilum of the spleen. So through the hilum of the spleen, splenic vessels are passing. Okay, splenic artery, splenic vein, they are passing. Okay, and very important point, please remember that spleen is making here the impressions: gastric impression, the pancreatic impression, the colic impression, and from the renal impression from the left kidney. So on the visceral surface, four impressions are forming. So on the visceral surface of the spleen, please remember, it is very, very important. On the visceral surface of the spleen, 4 impressions you must have to remember. Number 1, the gastric impression, which is formed by the fundus of the stomach. Okay, renal impression, which is from the left kidney. Colic impression from the intestine, which is from the splenic flexure of the colon, large intestine. Okay, and the pancreatic impression, it is from the tail of pancreas. Please remember. Okay, so please remember, the pancreatic impression is for the tail of pancreas, which lies between the hilum and the colic impression. Okay, so this is some points. Now coming into the ligaments of the spleen. So ligaments of the spleen are very, very important. Ligaments of spleen. So you must have to remember 3 ligaments of the spleen. So what are the 3 ligaments of the spleen? Number 1, gastrosplenic ligament. Number 2, linorenal ligament or splenorenal ligament also. And number 3, that is your phrenicorenal cocolic ligament. So 3 ligaments you must have to remember. Now see this diagram. This is the cross section. So this is our spleen, which I am highlighting in blue color. So this is the spleen and this is the stomach. Okay, so this stomach is here making this one ligament with the spleen. This ligament, which I am highlighting now in blue color, this is known as gastrosplenic ligament. So this is your which ligament? Gastrosplenic ligament. So gastrosplenic ligament extends from the hilum of the spleen to the greater curvature of the stomach. This is the lesser curvature, so this will be the lesser omentum. And here you have 3 structures. Portal triad. Okay, but now at the moment we are not discussing it. So in this gastrosplenic ligament, what is present? Your short gastric arteries are present. Short gastric arteries or vessels are present. Okay, so short gastric arteries or vessels are present. Very, very important. Second, it is making a ligament with the kidney, your left kidney. And this ligament, which now I am highlighting in red color, this is known as splenorenal or lienorenal ligament. Very, very important. It extends from the hilum of the spleen to the anterior surface of the left kidney. Okay, to the anterior surface of what? Left kidney. What it contains? It contains the tail of pancreas. Very, very important. It also contains splenic artery and splenic vein also. Splenic artery, splenic vein is also present in your which ligament? Lienorenal ligament. And some associated lymph nodes or lymphatics or sympathetic nerves are also there. So splenic artery and tail of pancreas. This is your MCQ. Splenic artery, splenic vein and tail of pancreas are present where? In the splenorenal or lienorenal ligament. Short gastric arteries and gastroepiploic artery, it is present in your gastrosplenic ligament. Okay, so these two are your very, very important MCQs which you must have to remember. Once again, I am repeating to all of you. Number 1, these two ligaments are very important in relation to the spleen. Okay, number 1 is your what? Number 1 is your gastrosplenic ligament. Which ligament? Gastrosplenic ligament. It is attaching the spleen to the stomach. Okay, and it contains what? It contains your short gastric arteries, veins, and your left gastroepiploic arteries and veins. Okay, veins and arteries also. Okay, so if anyone is going, this is your MCQ. Gastrosplenic ligament contains what? Your answer will be short gastric arteries and veins and left gastroepiploic arteries and vein. Done. Now spleen is also attached to your left kidney. By which ligament? Lienorenal ligament, which is also known as splenorenal ligament. What it contains? It contains splenic artery, it contains splenic vein, and it contains what? Tail of the pancreas. Clear to everyone? Now there is one more ligament present here. That is known as phrenicocholic ligament. This is the anterior end of your what? Spleen. So phrenicocholic ligament is doing what? It is holding the anterior part of the spleen. Okay, it is holding your what? Anterior part of the spleen. So this is your what? Phrenicocholic ligament. So phrenicocholic ligament, first thing what you must remember, it is not attached to the spleen. Okay, it is not attached to the spleen, but it is supporting what? The anterior end of the spleen. It is supporting the anterior end of the spleen. It is a horizontal fold of, you can say, peritoneum extending from the splenic flexure. This is your splenic flexure. This is the greater omentum, greater curvature of stomach and spleen. You have this gastrosplenic ligament. Okay, gastrosplenic ligament. So see here, it is a horizontal fold of the peritoneum extending from the splenic flexure of the colon to the diaphragm. That is why it is known as phrenicocholic ligament. Okay, phrenicocholic ligament. So it limits the upper end. Okay, so it is this ligament. It is also known as what? Sustentaculum lenis. Okay, it is also known as what? Sustentaculum lenis. Clear to everyone? So these are the ligaments of the spleen. Now coming into the blood supply of the spleen. So blood supply of the spleen is very, very important. So first of all, we must have to see the arterial supply of the spleen. So what is the arterial supply of the spleen? Arterial or artery supply of the spleen. So it is given blood supply by this artery, which I am highlighting in blue color. See? So this is your which artery? Answer is the splenic artery. So splenic artery, it is giving blood supply to the spleen. Okay, so splenic artery is doing what? It is giving blood supply to the spleen. Please remember this splenic artery, it is coming out from this branch of the abdominal aorta that is known as celiac trunk. So celiac trunk has three branches. Common hepatic artery. Number two, the largest one, that is the splenic artery. So please remember, splenic artery, it is the largest branch of the celiac trunk. And then one more artery, that is your left gastric artery. Okay, these are the three branches of your celiac trunk. So celiac trunk is giving here the branch, the splenic artery, which is giving blood supply to the spleen. So it is giving blood supply to the spleen. It is also giving here branches. It is also giving here the pancreatic branches, the great pancreatic artery, the dorsal pancreatic artery. Okay, but important arteries which you must have to remember, splenic artery branch, that is the short gastric arteries. So short gastric arteries, which is giving blood supply to the fundus of the stomach, it is coming out from the splenic artery. Okay, and second important branch which you must have to remember, answer is your left gastroepiploic artery. Okay, short gastric artery and left gastroepiploic arteries, it is branch of your splenic artery. And now it is ending here in 5 terminal branches. 5 terminal branches. So please remember these 5 terminal branches of the spleen, it will divide and give blood supply to the individual segments of the spleen with no anastomosis. Please remember it forever. No anastomosis. So all these are your end arteries. So if there is any obstruction or splenic infarction occur, you must have to remove that part. Okay, clear to everyone? So this is your splenic artery. Now coming into the venous drainage of the spleen. So please remember, venous drainage of the spleen, it is through the splenic vein. Now see here, splenic artery, it is present on the superior border of the pancreas. But splenic vein, it is present behind the pancreas. So this hole which I am highlighting in green color, this is the splenic vein. It joins with this superior mesenteric vein which I am highlighting in red color. Okay, anterior to the uncinate process of pancreas, and when it joins together it is going to form here this large vein which is known as the portal vein. Okay, and please remember your inferior mesenteric vein, it is usually draining into the splenic vein. So it is draining where? Into the splenic vein. Left gastroepiploic vein also draining into the splenic vein. Short gastric veins also draining into the splenic vein. Okay, so these are the important points of your venous drainage. Clear to everyone? Now coming into the histology of the spleen. So for histological point of view, please remember, as you can see in this diagram, number one thing what you must have to remember, that spleen is composed of red pulp and white pulp. Okay, it is composed of what? Red pulp and white pulp. So first thing, red pulp, as you can see, this all this area reddish color due to the presence of large amount of the RBCs. This is known as the red pulp. Okay, so red pulp constitutes about 70 to 75% of the spleen, and it consists of large number of your RBCs. Okay, and please remember, red pulp, very important point, red pulp, it consists of splenic sinusoids and splenic cords of Bilroth. Okay, so it consists of sinusoids and splenic rods of Bilroth. What is white pulp? This is your white pulp. So white pulp, white is white because of increased number of white blood cells. So increased number of white blood cells arranged in this manner, this is known as white pulp. Okay, please remember, it composed of white pulp, it consists of 20 to 25% of the spleen. Okay, it consists of what? 20 to 25% of the spleen. Now some points in relation to the these red pulp and white pulp. Number one thing, that red pulp, see here, it consists of what? It consists of your splenic cords of Bilroth and the splenic sinusoid. So see here this red. So this is the red pulp. This is the red pulp, and it consists of splenic cords of Bilroth and splenic sinuses. Okay, splenic sinuses or splenic sinusoids. Okay, and these are your what? These are your white pulp. So this is your white pulp. So please remember, what is white pulp? It is a lymphatic nodule. Okay, so what is present in this lymphatic nodule? Please remember, in this lymphatic nodule, as you can see in this diagram, this red color central arteriole or splenic arteriole is present. So this central splenic arteriole, it is not placed centrally, it is placed to one side, as you can see in these white pulp. So it is known as eccentric. It is known as what? Eccentric. Okay, now very important point in relation to these white pulp. These red, you can say white pulp, it is also these splenic centrioles. They are surrounded by a sheet around it, and it is known as periarterial lymphatic shield, pulse. It is known as what? Periarteriolar lymphatic sheet. Now see here, very important point. In relation to this lymphatic nodules, which you must have to remember is what? That this lymphatic nodules or white pulp, okay, so this white pulp, see here, so this white pulp, it has its central part that is known as the germinal center, and this germinal center contains what? It contains B lymphocytes. It contains what? B lymphocytes. This white pulp, as you can see, this is the white pulp or lymphatic follicles or lymphoid follicles. Please remember. And in the center, this slightly whitish area that is known as the germinal center, it composed mainly of your which lymphocytes? Answer is B lymphocytes. Whereas the T lymphocytes lies in the periphery of these lymphoid follicles. Okay, and please remember, this is your eccentric arteriole. So if this eccentric splenic arteriole, when it is surrounded by your peripheral T lymphocytes, it is known as PALS, periarterial lymphatic sheet. Okay, now see this diagram, all students. Okay, so this is your what? This is your one white pulp. Okay, this all which you are seeing here in red color, that is known as the red pulp. Okay, now this white pulp, see here, this is the germinal center. Okay, so this is your germinal center. This is your eccentric arteriole. See here, this is the eccentric arteriole. 1 second. This is the eccentric arteriole. Eccentric arteriole. So this arteriole, please remember, it is surrounded here by the T lymphocytes. So it is known as what? It is known as periarterial lymphatic sheet. It is known as what? Periarterial lymphatic sheet. Okay. Now some other points in relation to the spleen. Histologically, what you must have to remember, that it does not contain cortex, and see here, it does not contains no cortex, no medulla. So how you can distinguish here? There is no cortex and no medulla. Okay, so no cortex, no medulla. Okay, and then it contains what? It contains red pulp, it contains white pulp, it contains these trabeculas. See here, these are the trabeculas. Okay, trabeculas are thick, and it contains, see here, this is the no cortex, no medulla. It is the capsule dense collagen connective tissue or smooth muscles. Red pulp, white pulp. So red pulp and white pulp consist of what? It consists of splenic cords and splenic sinusoids. Okay, splenic cords and splenic sinusoids. So what are the functions of these red pulps? See here, RBCs, for example, when they are passing through these structures, that is the splenic cords of the red pulp or splenic cord of the bilirubin. Okay, so what happens, that erythrocytes or RBCs must have to pass through these red cords of the bilirubin before entering into these splenic sinusoids. Okay, and when they are passing through these sinusoids, please remember, they must have to squeeze through these sinusoids. But if they are irregular in shape, for example, if patient of hereditary spherocytosis, so what happened, that in such scenarios the RBCs cannot squeeze through these areas or through these sinusoids, and they will break down. Okay, resulting in what? Breakdown of the RBCs. So please remember, spleen, it is the largest lymphoid organ, but it is also a graveyard of the RBCs in adults. So in adults, it is a graveyard of the RBCs. And what are the function of the spleen? So functions of the spleen, please remember. Functions of the spleen, it is a removal of old or abnormal RBCs, formation of immunoglobulin M production by the plasma cells, storage of platelets, protection of you from the you can say from infection. So all these are the functions of the spleen. So what will be the function? It can be phagocytosis, it can be hemopoiesis in the early fetal life, not in the adult life. It is helping you in the immune response. It is also a storage of the RBCs. If the RBCs become fragile or dead, it is going to remove those old RBCs, and RBCs who is having some, you can say, like disorders like hereditary spherocytosis, they must have to remove it. So functions of the spleen, please remember, functions of the spleen: phagocytosis, hemopoiesis, only in fetal life, okay. After that, it will only take in the formation of lymphocytes, okay. Immune response, for example, immunoglobulin M production, plasma cell formation, okay, storage of RBCs, removal of old RBCs, okay. And if there are any other disorders like hereditary spherocytosis or other thing, in such scenarios, they cannot pass through these cords and they are going to be destroyed. So it is also the function of the spleen, okay. So these are your what? Functions of the spleen, okay. So removal of the pathogens, removal of the old abnormal red blood cells, storage of platelets, protection from infection, all these are the functions of the spleen. Clear to everyone? Now very important point in relation to the spleen, please remember, very important point, in blunt trauma of abdomen, most common organ which is damaged or rupture, answer is spleen. This is a very important MCQ. So please remember, spleen, although the spleen is protected by your 9th, 10th and 11th ribs, okay, but still it is the most commonly ruptured organ in blunt trauma of abdomen. And when it is going to rupture, the pain is going to referred into the left shoulder, and this is known as Kehr's sign, okay. So a patient comes to you blunt trauma of abdomen, and he is going to say to you, say, doctor, I also having a left shoulder pain developing. So it means what? That under the left dome of the diaphragm, there is splenic blood is present, which is irritating the patient and it is causing pain. So it is known as what? Kehr's sign. Okay. So this is known as what? Kehr's sign. One more important clinical correlation in relation to spleen, which you must have to remember, is splenomegaly. So see in this diagram, so this is your right iliac fossa. So whenever the spleen become enlarged, it will become enlarged in this direction. Okay, so enlargement of spleen is known as splenomegaly, and its enlargement will be towards the right iliac fossa. It will be towards what? Right iliac fossa. Clear to everyone? So these are some of the important points of the spleen which you must have to remember. I hope it is clear to all of you. Thank you.